Hi, everyone. Thank you for joining today. We're going to just wait one more minute for folks to dial in before getting started here. All right, we're going to go ahead and get started with today's webinar on how to leverage text messaging to increase access, improve quality, and boost the bottom line for your FQHC. We're excited to have a great group of FQHC leaders all across the country joining in today. My name is Gia Charles. I'm the head of marketing at CareMessage, and we work with FQHC leaders across the country to help them develop patient engagement strategies and better care for their underserved populations through text messaging. As a nonprofit technology organization dedicated to improving health outcomes for the underserved, we really enjoy hosting our ongoing series of webinars like this one, as well as our community series of events across the country to bring together FQHCs and sharing best practices and learnings with one another. Just to review some of the logistics for today, we're going to kick off with a 30-minute presentation, then move to 15 minutes of Q&A. And we want this to be really interactive, so feel free to ask questions throughout by clicking the Q&A button at the bottom, typing in your question. We're going to save those and come back at the end. And finally, we are going to be sharing this recording with all of you by email afterwards. So it's my honor to introduce Sergio Batista. He is currently the Chief Deputy Director at ChapCare. And in this role, he oversees the CFO, the COO, CAO, and strategic development. Previously, he was ChapCare's CFO and COO. Prior to that, he's worked in both the public and private sectors, including 6 years as Northeast Community Clinic's CFO. Sergio is committed to improving access to high-quality, comprehensive primary health care to underserved populations. And I'll let Sergio take it from here.
Thank you for the introduction, and thank you for everybody that is attending today and those that will be listening to the recording. Just a little bit of background on our organization. We're Community Health Alliance of Pasadena. We just celebrated our 20th anniversary, but really our expansion as well as our rebranding started roughly before the Affordable Care Act. This is going back to 2011. We had one health center back in 2010. Now we have 8 health centers located in the San Gabriel Valley. And we're servicing over now 6,000 unduplicated patients, annually. We took an early advantage of outsourcing our EHR, our electronic medical records, by joining the OCHIM collaborative, which is Epic-based. That provided us with the ability to really concentrate on what we needed to do, which was to provide really comprehensive services, for our population as we knew that we were going to grow, which we're currently at 8 health centers. We provide medical, dental care. We have our own retail pharmacy. We introduce optometry, podiatry, behavioral health, and substance abuse counseling. And we're really getting into more on looking for other care coordination, activities really that go within the homeless population that we have served, since the beginning. One of the things that we did before the Affordable Care Act really was to look at how do we go about looking at the landscape of our healthcare industry and understanding that as we were going from a very passive, relationship that we had with our patients, really trying to engage them in a more comprehensive way turn them into active patient participants of their health. As you see, and we understood back then, is that we were going to go from a very episodic care to a value-based system, payment system, and we needed to make sure that our patients, were going along with it as we were trying to envision what this would look like. One of the things that we did was we adopted an engagement strategy, understanding that, turning, our current patients from passive patients that, listen to the providers to more of a health center that, embeds a culture of active patient engagement, asking them, what is it, that they're really looking for in their care and what additional services they need in order for them to have more proactive and preventive care rather than the episodic care that we were seeing. What we did was really developed and execute our patient engagement strategy, which really provided us to go into uncharted territory at that time. For us, patient engagement is just not the patient communicating, or it's not just the communication or education, or simply to just let patients know, go to your portal and ask questions. For us, true patient engagement refers to the knowledge, skills, and abilities, and the willingness of the patient to manage their own, as well as getting the family members involved. If you have diabetes or have other, chronic diseases, it's not just the individual that has that particular condition, but also they need support of their family members, in order to ensure that their care is very well, in check. The culture of healthcare organizations that we prioritize and we support for our patient engagement really was looking at a very collaborative, relationship between our patients and the providers, and, really to design and manage and achieve those positive outcomes that we were looking for, making sure that we had the tools to be able to ensure that the patients were going to be utilizing in a way that would make a change in their health. One of the things that we looked at was what were the key elements of a successful patient engagement. And one of the key areas that we looked at, starting from defining our vision for patient engagement in our organization and creating through meetings and, stakeholder internal meetings, engaging our staff to make this cultural change. One of the keys that we looked at is how are we going to be able to employ the right technologies in order for us to execute and implement the services that we wanted to provide to our patients, in order for them to be empowered and to become a collaborative member in their own individual healthcare. We also wanted to make sure that, we were looking at the outcomes and seeing whether we were successfully getting to what we were trying to achieve, and really getting us ready for that ultimate change and ultimately the adoption of the new technologies, as well as our patient engagement strategy. We considered different, and looked at that point, looking at text messaging as a means to be able to go ahead and reach additional patients where they were at, and seeing how that would change their outcome. We were looking for somebody that had a mission and a track record of, impact in the community. Also, we wanted a vendor that had the ability to have the perspective of an FQHC, and also the patients that an FQHC services. Also, we wanted to ensure that that the product was easy to use and scalable, as we went from one health center to multiple health centers, now up to 8. Look at what the broad coverage of use cases that we could do. We weren't looking for a tool in our strategic initiative that only served one particular element, but we wanted to see, is that particular tool or vendor able to be used? And we're going to show you the different user cases that we're using, our text messaging platform in order for us to, reach our patient and target demographics. We were an early adopter of, CareMessage because we saw the possibilities. They were a nonprofit technology organization, and they were an early leader in continuing to be a leader in text messaging, with multiple use cases for us to use in our technology. So what were those user cases? And we're going to get more in detail into some of these 4 elements that I'm going to be referencing. We use CareMessage for our health insurance appointment reminders. We were an early adopter prior to the Affordable Care Act, being live, looking to see how we were going to be notifying our patients when they needed to get enrolled. And also we understood that we needed to have a messaging platform earlier to remind them of their annual re-enrollment that they needed to do. So that was one user case. Also, our patient outreach. Our outreach group actually wanted to make sure that as we were getting new members from our independent private association under an HMO scenario, we wanted to make sure that on a monthly basis we would be sending them, enrollment related to who we were, as well as what they need to do in their individual usage of their insurance. Also, health education, looking at text education programs for chronic disease management, such as diabetes, and we'll get more into that. Also, we wanted to make sure that we weren't losing patients. It's hard to outreach, it's hard to get, patients, but we wanted to make sure that, we were managing the patients in order for us not to lose, within a year or sooner, those patients that we were gaining. So by utilizing CareMessage, we were able to engage, assist staff to manage our patients, and really educate on all the different stages of the healthcare continuum. So we're going to go on to the next slide, and the next slide, really encapsulates our trajectory on the use of text messaging through CareMessage. One of the things is that we want to make sure that we increase the volume of patients that we had in California, and being really ready to get into the insurance marketplace. As you know, 2014 was the deciding factor for everyone as far as the Affordable Care Act and the expansion of Medi-Cal. So we wanted to be able to be ready. In 2016, we also looked at, a health education program just to prove to everybody that, minority populations or disenfranchised populations do use text messaging, especially through the phone. And that's one of the initiatives that we did. Also looking at care gaps, we were now being measured, as far as the HEDIS, making sure that the patients really got all the services that they needed. So we needed to use text messaging in order to get, different efforts, and we'll go through that as well. Also, the biggest payoff, because the rate of return on the investment of having a tool such as CareMessage, we wanted to make sure that, we were gaining, not only great quality, but also from a monetary perspective that we were able to sustain the program that we had. So we'll go through that as well. So we'll go to the first user case. The challenge was really to increase the volume of patients' communication through the Affordable Care Act and the launch of our healthcare insurance marketplace. So we started to as soon as patients were coming to us, we were able to support the insurance enrollment process here in California with our messages by sending them messages related to when the open enrollment period was available, experiencing, what they needed to do with the time and money savings through automating a lot of the efforts instead of having our outreach workers go out there and trying to find different, patients that were eligible for insurance. We were able to look at our internal system to see who could potentially be insured that currently at that time was uninsured. Since then, ChapCare ourselves, we have reduced our rate of uninsured patients from 28% to 21%, while increasing its overall patient volume. And again, we're seeing the rate of returns because it is best that we get somebody that's insured from a financial perspective than it is to cover, somebody that could potentially be uninsured, knowing that, they can get additional services once they're insured. Next. The other, from a quality perspective, our CMO at that time was telling us that text messaging may not be the best way to do an intervention for low-income patients that had diabetes. So we teamed up with CareMessage along with the University of Berkeley to see whether that was the case, and that was a test case that we did back in 2015 and 16. We began to offer, our patients in this pilot program a 12-week diabetes program, at 2 of our clinics. The results were amazing, and we were able to publish this along with UC Berkeley. We produced a clinical meaningful improvement in the glycemic control. Again, it was 0.62 reduction in the HbA1c with higher engagement patient experience, to 2.23 reduction. I think, overall what we learned out of that particular project is that our population wants to engage through a text messaging system for self-management, and we were able to create a community within our patient base that was able to go ahead and look at, their own health, and that was the impetus for us to do the patient engagement back in the early days, and we're seeing the results through the affirmation of the type 2 diabetes health education program that we rolled out. Next slide. Starting in 2016, and you're gonna see, our efforts. We really begin to look at, reducing the gaps in care in our patients, through the HEDIS. We looked at, what would be not only the good thing to do for our patients, which was quality, and also reduction of, of their conditions, but also, is that something that could sustain other efforts? And what we were able to see in this user case is that by us targeting where our gaps in care were, whether it be mammograms or whether it be an IFOBT or whether it be an annual wellness exam for children or the adult senior annual exam, what we found out is that we were able to significantly see improvements in our clinical measures. We were able to improve by 13, almost 14% in the adult hypertensive patients whose blood pressure was less than 140/90 in the past year. In fact, we were recognized by several organizations regarding our efforts, and we were given the gold seal of approval. The other thing that we were able to do is almost a 20% increase in the number of influenza vaccines that we actually did in the last year. Also improvements in the number of patients with appropriate colorectal cancer screening, and then the adult diabetics, as well. So those were the caring gaps that we were able to achieve by messaging and tailoring the messages to the patients that, were targeted for the gaps that we wanted to achieve. The last one was the integration of our Epic system for our appointment reminders. And we're going to look and see what this integration meant for us. We wanted to look at a reduction in our no-show rates through clinical appointment reminders integrations. We do our appointment reminders, by a live person, 72 hours before, but we wanted to see, can we do this via phone or other ways, or even automation? And the result was, starting in March of 2019, that our no-show rates decreased from 18% now almost to 16%, which is a 2% decrease, which is significant for us, as you see 8 health centers and overall over 72,000 visits annually. So from that point of view, I just want to show you and share some of the outcomes of of the impact that text messaging had in our no-show rate. Based on 78,000 appointments that we did over that year, if you were to just take 155 reimbursement, the total revenue opportunity was 12.9 million. and the actual revenue that we got was 9.3. So the cost of no-shows is really $2 million. So it's significant. So by reducing that 2%, it really allowed us to at least gain $245,000. We are looking at it, and our goal is to really get it down to hopefully down to the low teens, or maybe it's been one of the big holy grails. If we can do it below 10, that would be great, because it will have an impact financially, and also is the right thing to do is to get the patients in for their preventive care rather than the episodic care that they're getting. I wanted to share this particular slide. In the state of California, and specifically in Los Angeles, we do have a HMO that allows us to gain pay-for-performance payments and incentive payments. So what I went back to and looked at is to see what is it that we're earning and what is it that we're not earning, in order for us to start seeing whether the usage of a text messaging systems in our HEDIS measures to do the comparison gap has made an impact on our bottom line regarding our pay for performance. And as you can see in the graph, we had a significant amount, and not as much as we would like, but at least it allows us to gain a better understanding of what we're missing out, what we're leaving on the table. Our goal, along with our board, is to at least get to 80% of what is the maximum, and for that we come up with another strategy on how to go about making those changes in order for us to gain more pay-for-performance in our HEDIS measures. There's 3 points of improvements that we're going to be doing over the next 12 months. One of them is to further develop our data warehouse in order for us to integrate the various data sources that we get, whether it be from our IPA or our insurance, or even the hospital admissions and discharges, into one place, in order for us to look at the patient's gaps, in order for us to make an executable plan for that. We're also redesigning provider onboarding training. We're establishing, which we have, but we're a more robust training for our medical discipline center and evidence-based protocols and best practices on patient engagement. We currently do have an onboarding process, but it's really geared towards how to use the EHR. And what we're really leaving behind is the evidence-based protocols and the best practices. So what we want to be able to do with our redesign of our provider onboard is to really look and see, how can we start from our training of the providers before they hit the floor with all the tools that they need in order for us to get better HEDIS measures. Also redesigning our QA/QI department. We want to look and see, what is it that our current QA/QI department is doing and the resources that they have, as well as the roles and responsibilities, and to see whether our future needs are and how many additional staff we may or may not need. What we want to be able to get to the point that we're not looking at the gaps in care, but actually bring everything upstream to be able to, through the redesign of the provider onboarding, to get a lot of those things ahead in order for us to get better outcomes with our HEDIS measures, in order for us to get additional pay-for-performance payments. Community Health Alliance of Pasadena or ChapCare, we're, as our mission statement says, one of the 3 tenets is that we are innovators. We like to work with other systems in order for us to really gain additional best practices, as well as to look at the changing landscape. So we work with Point Care, which is a web-based applications used for health insurance screenings and enrollments. And that has worked really well because it does have a robust data reporting. So we wanted to find out, who are these patients that we're outreaching, and can we use that information that we're gathering to see how we can better gain an understanding of who they are or why they're not insured. The other is talking surveys. Talking surveys basically is the ability to have in a tablet when we do our annual or special surveys. What we do with it is that it talks in their own individual language. So we give them a headphone and a tablet, and they're able to answer those questions in their own language, and allows us to get a better understanding of our, surveys. And the outcomes that we get. The other one that we're really proud of now is Hitch Health, and that is an integrated product with Epic, which is an automatic process to have the lift rights available for our patients to attend their medical appointments. In the old days, we had a contract with a taxi cab company, but we never understood or knew whether the patient was going to show up or not because we didn't have any visibility. Through Hitch Health, just like if you use on your own, whether it be Uber or Lyft, it tells you where the ride is and how long it will take you to get there. Well, now our staff knows whether the patient was picked up, or and if so, whether they're going to be late, or in order to make adjustments, or to cancel the appointment in order for us to be put in a walk-in. So those are the three other systems that we're working on, or that we work on, because of the fact that we are an innovative group. So what's next for ChapCare? We want to be able to expand the use of CareMessage, for additional health education programs. Once we start integrating the additional components into our Epic system, we would like to have the ability to identify the patient that needs, whether it be additional hypertensive or education or diabetes or other, just health related, education, whether it be nutrition. But we want it to be integrated with Epic, so that way the providers can go ahead and do the order, and that automatically goes through the integration of CareMessage in order to get them enrolled into the system. Utilize the technologies, for immediate patient feedback, mechanisms. I think, seeing whether we can expand CareMessage for surveys or other items in order to see and ask the patients what other services they may need. And we want to develop additional enhancements to outreach for messages and overall improvement of text in different languages, and also just be a partner, which is really what we looked for when we started out this venture with CareMessage, was to really look at the vendor not as somebody that was providing services, but somebody that could be a partner with us to reach our goals, which is, to see where the next innovation or the next need of our patient base really is at. So what would I say, to individuals that, ask me the question of why did I selected, text messaging, or what should I consider? From our perspective, we just say, we just don't want to have a standalone program. We want to tailor the program to patients' baseline, whether it be, diabetes or other systems. Look at what the text messaging world is really coming, especially with CareMessage, and see whether the population is, being used in other random trials or design other activities in order for us to gain more insight into our population. We want to also get more enrollment and research for in-person. What is it that, is it better to do in person versus an automatic enrollment? For different programs that we can best identify the needs, or is text messaging something that is positive or negative? And overall, encourage all the participants, at the end of the day, from a health center perspective, that you should start creating a patient engagement that is really active, rather than what we've been doing for a very long time, which is have a very passive engagement with our patients. That is really all that I have for you, unless anyone has any questions for me or for the group.
Thank you so much, Sergio, for such an insightful presentation, sharing some of the strategic patient engagement work that you and the ChapCare team have pursued over the past couple of years there. We're now going to open it up to some questions from the audience. So I see we have some already, and please feel free to click the Q&A button and add some more. So let's see, to kick off on the first one, I'm going to just read the question out loud. Hello, thank you for the information. We have had less luck with texting campaigns. The feedback our patients have provided is that it looks like spam and they delete it immediately. What have you done to combat this? So this one is for Sergio. And let me also clarify, if we do have any questions regarding the CareMessage platform, we have Senior Account Executive Blair Lynham on the line who will answer those. So hand it back to you, Sergio.
Yeah, what we did was we started educating our staff as well as our providers in messaging what the platform was going to be. So having staff participate on the initiative really was important, because then they would say, we will be sending you a message related to X, Y, and Z to the patients as they were in the clinic. And that's how we were able to combat some of the resistance or, the inability. Also, we use CareMessage a lot to see whether the phone numbers that we had or that we were sending texts to, whether they were valid or not, in order for our staff to find out when the patient came in, to let them know that, whether they had changed their phone number or not. But it really is an internal campaign that you have to do in order to combat that resistance.
Thank you. We are open for additional questions. Give it just one more minute, and I'm going to also reshare the presentation here. Feel free, any questions for Sergio around what he shared today, any questions about CareMessage, we welcome. We'll give everyone just another minute here or so. All right, I'm not seeing any additional questions yet. We will be sharing this presentation by email, so that way you can reference back, or feel free to share with any teammates who weren't able to join. For any additional questions about CareMessage, feel free to email Jessica Day. We have her email here on the screen. And I think we had another question come in. So here, let me read it out loud. Hello, great information. This is coming from Dahlia. As far as the diabetic campaign, were you sending health tips, or can you talk a little more about the content of the messages? So this one is for Sergio, and then, Blair at the end, feel free to also to share further.
Yeah, the study, what we ended up doing, and what the study really was looking for, is the usage of a community with different messages for self-management. We didn't send any kids. Everything really was through text messaging, through the resources that, CareMessage had. What we encourage everybody to do, and as part of the study, was to come in on their appointments. And for our providers, and this goes back to the first question, we educated our providers on the fact that we were doing this particular study, to ensure that once the patient came in, that the lab testing was also ordered and analyzed. And also, we had our providers encourage our patients, and letting them know that that they had done improvements, and congratulate them on the fact that they were having a successful impact. So it was really self-management, and there wasn't really any testing kits or anything sent out to them.
Thank you, Sergio. And Blair, I think you also wanted to share a little further here.
Absolutely. Hi, everyone. And just on the nature of the health education programs, just to kind of clarify what they are, they're multi-week interventions. So the content is pre-created and interactive and automated, and it's all through texting. So the patient would receive about 3 messages per week, some of which they can respond to tailor their own experience, and then ultimately get different health tips. There's resources for, oftentimes, a national hotline to call for diabetes, for example. And that's one of the 19 programs we have focused on anything from hypertension to CHF, asthma, maternal health, and have some behavioral health programs as well.
Great, thank you, Blair. Our next question is from Erica Hernandez. How do you choose when or what to outreach via CareMessage? Do patients ever feel bombarded with texts? So this one is for Sergio.
They don't, and the reason being is that we look at it from the perspective of what we're trying to achieve in the caring gaps. So they're not getting constant messages. They're really getting messages as it relates to what we're doing. The caring gap is, whether it be an IFOBT or whether it be a mammogram, or the flu. For the flu, yeah, they'll get. We started 2 months ago talking to them about flu season is coming around. And then we waited some time, almost a month, and then we sent another message. So we don't send on a weekly basis all these things. It's very thought out of the campaign, and that is part of our marketing group, along with our QAQI group. They get together and say, okay, for this month, what are we trying to achieve, and what messages are we going to be sending out and to whom? So we haven't had any patient come to us really upset, whether it be sending us a message or at the end of the day come into the clinic and say I'm getting too many messages. We haven't had that experience, but it is a managing aspect that you have to take into consideration.
Thank you. These are great questions, and nothing better than hearing directly from Sergio on how they've managed this. That's our latest question. Any others? We'll just give it another minute here. I think we also have a new Q&A that I'll be reading out loud shortly. Okay, how do you choose when or what to outreach? Oh, I think this is the same actually as the one we just shared by Erica.
I think the next one is Linda Chan, and the question is, did you find that in the beginning, when first using CareMessage, there was a lack of response from patients? I think we combated that by, letting our patients know ahead of time that this new tool was going to be used and what to expect. So we didn't encounter that. I think what we found is that, making that awareness campaign ahead of time really resolved, the ability for the patients not to be responsive to the message. I think that awareness campaign really helped. And now, making sure that we let them know on a constant basis, and our staff knows to do this, is to say, look, we're going to be outreaching in different forms, and one of the forms that we're outreaching you to is through text messaging. And if you do, if you have any questions, come and let us know. So it really is getting our staff engaged to do those things. As far as the second question from Linda, how do you get more patients to respond? again, I think the fact that our providers are letting them know that that's important, aside from the fact that we do have a portal that they could, get additional information. I think that's really what makes a difference. Also, if we know that people are not responding, a lot of times what we do is, is we'll say, look, we're going to be doing a new campaign, and if you're selected, we're going to give you a gift, right? It could be a gift card, in order to get more people to get involved with text messaging as well.
Thank you, Sergio. We've got just a couple minutes left for any final questions today for Sergio or for CareMessage. All right.
I think everybody's hungry or is already eating lunch.
This has been a wonderful session. Thank you again, Sergio, for sharing all the experiences and the tips to everyone on this call. Thank you everyone for dialing in. Hope you enjoyed this session, found some valuable tips. We look forward to sharing the video, the recording by email afterwards, and hope you have a great rest of the day.
Thank you, everybody.
All right, bye-bye.
Bye.